Hello, I am Dr. Sirena Paricio from Trust Dental Care, your dental office in Tijuana, Mexico. Today, I would like to take the opportunity to talk to you about dental implants. If you're self-conscious about missing teeth, there's an alternative that may be right for you: dental implants. They offer comfort and stability, and because of the artificial tooth it supports, it is a therapy that is the closest thing to a natural tooth. Therefore, dental implants are an option for replacing missing teeth. There might be several questions you have, like, how can I benefit from a dental implant? Well, dental implants are replacement tooth roots. Restorations are screwed or cemented onto implants, usually after a waiting period that allows the bone time to heal. It is possible to replace a single tooth, several teeth, or a full arch. Many other questions you might have are, what does the implant look like? Or where is the implant placed? What is a dental implant made of? Well, the implant resembles a metal screw that is surgically placed in the alveolar bone. Most often, the metal is titanium because it is compatible with human tissue. Another question you might have is, how will the dental implant hold to my bone? Well, the implant integrates with the bone tissue through a biological bonding process called osseointegration. Osseointegration usually takes 3 to 6 months following surgery. Another question you might have is, how will the dental implant replace my teeth? Well, once the dental implant has integrated to the bone, a fixed or removable prosthesis is fabricated. What kind of artificial teeth will replace my missing natural teeth is probably another question you have. Well, the prosthesis may be a single crown, a bridge, a partial denture, or even a complete denture. Now, let's review the treatment sequence for a dental implant. And again, I will be trying to answer all the questions you might have in your mind about dental implants, like, who do I see first about a dental implant? Well, the success of a dental implant depends on a coordinated team approach: general dentist, maxillofacial surgeon, periodontist, and most importantly, good patient cooperation. Another question you might be asking yourself is, how long will it take to finish all the phases of the implant process? Well, it's very important that you know that every case is different and must be analyzed independently. Therefore, the implant process can take 3 months average, and some cases even less, and other cases can take 6 months to complete all the phases of the dental implant process. Very important is the diagnosis. A thorough initial evaluation of a potential implant is critical to successful treatment. Diagnosis includes general health and dental evaluations. Therefore, another question you might have is, what can I expect on my first consultation? Well, the process begins by meeting with the general dentist, who will review the patient's medical and dental history, take necessary radiographs, take impressions for study casts, and complete the oral examination. Neighboring teeth and gums must be infection-free. The general dentist refers the patient to the oral surgeon on this same appointment. Now, the oral surgeon will evaluate the patient's health, the most common systemic conditions, and their implications for dental implants. These would be like smoking, uncontrolled diabetes, osteoporosis, head and neck radiotherapy, and immunocompromised patients. Now, the dental examination particularly relevant to the implant therapy, the oral surgeon will look at the arch shapes, size, and determine the number of implants needed, the available space between the upper and the lower arch. At this time, the patient must also consider the time commitment, the expense of the procedures, and the risks of a surgical procedure. The time to start to finish is approximately 6 months. The cost of the implants, and you must consider also additional procedures. After the diagnosis is complete and the patient accepts the treatment plan, financial arrangements are completed and treatment appointments are scheduled. Now let's review the treatment planning for a 2-stage implant. Treatment generally is a 3-part process that takes several months. In the first step, the oral surgeon surgically places the implant in the jaw, with the top of the implant slightly above the top of the bone. A screw is inserted into the implant to prevent gum tissue and other debris from entering. The gum then is secured over the implant. The implant will remain covered approximately 3 to 6 months while it fuses with the bone in a process called osseointegration. In the second step, the implant is uncovered and the oral surgeon attaches a healing abutment, allowing the gum tissue to heal around it. Once healed, the implant and abutment can serve as a foundation for the new tooth. In the third and final step, the dentist makes a crown which has a size, shape, color, and fit that will blend with your other teeth. Once completed, the crown is attached to the implant abutment. Thank you very much for your attention, and we hope to see you soon at Trust Dental Care.